Hello everyone. So today we are going to talk about ear infection. It's a very common problem. Even the children, even the everybody in their life could have a ear infection. And if some people they only use doctor's antibiotics to treat it, or even steroids, or even other kind of treatment which is drugs related, and they really cannot completely help the ear infection. And I have found a treatment which can quickly and help deal with ear infection. And I have treated amazingly, I treated a baby 2 years old, and he suffer from the ear infection oftenly every 4-6 weeks, and he complains the ear pain, and then go to the doctor, and the doctor said, "Oh, you have ear infection," and then give antibiotics. Sometimes takes 3 different antibiotics to help it, but the baby not feeling well, and also oftenly have a sick or congestion or cough or other things. And when the child's grandmom told me about this, and I said, "Oh, you bring here, let me have a look." I have found some special treatment which helps the nerve system and go to your ear to make the ear immune system strong around the face, around the ear area, the immune system, and will protect you and to fight with all kind of infections. And amazingly, I treated the child for maybe only 10 minutes, and then since then the family reports the child never ever have any ear infection anymore, and all the cold, everything seems gone completely. It surprised me. I thought maybe need a few treatment. So here I introduce this treatment, and if you many people they don't believe, and some doctor even said they think it's too good to be true, but it's fact. All right, it's fact. So I, based on all the facts, I give this secret to all the families, to all the people. They want it. All right, I don't keep any secret. I want to help the world, help the people. Okay, now I tell you the treatment. I think probably people still think I'm only talking one part. It is very important. All right. So even a child, and when easily they can falling down, all right, falling down. When they falling down, hit their head, and then their head will flick backwards. When they flick backwards, then they can tight the small joint, which there's no disc, right? First atlas and the axis area, and also with the occipital bone. There's a small joint here, all right. This is a small joint. And this joint can be tight, and there's no real force can make it go back to healthier, normal. All right. So then this part will tighten the nerves, and all these nerves will go to the face, go to the ear, go to the nose, or some of them even go to the throat area, all go to here. And this can involve the sympathetic nerves or even some part of the vagus nerves, and which help the local lymphatic system or lymph tubes, and to clear all the infection or to send the nutrition to the area, to protect the area. So if this blocked, if this nerves being blocked, like narrow, for example, it's like this two vertebra, all right, here. If narrow, then you can see the nerves, all right, be pressed, all right, like here, can be pressed like this, right? So, and when the child come here, so I hold their head and then just squeeze and move all these vertebrae. And amazingly, some of them, they can have a clearly clicking sound, alright, clicking sound. And this clicking sound just strong enough to free and the movement again, makes the nerves free. And this nerve will send the good nutrition to the local area and to do the job, which is keep the skin healthy, keep the eardrum healthy, keep the tubes open, keep the bacteria washing away by your mucus or whatever, and then this body will regain the health. It really works very well, and I treat the adult and the children. They both working very well. Okay, if you believe it, you just simply do this movement, and or you learn from me, do some movement to make sure this area is healthy and movable, flexible, and comfortable. Alright, if that's not comfortable, then must have the problem. Alright, as your ear or your nose or your face or eye all can be infected. Alright, thank you very much. Hope you like it. Bye.